Medical professionals, what is the stupidest misconception a patient has had about the human body? I still remember reading a Reddit comment from a doctor years ago that they were telling the person they were about to lose a finger. They said the person seemed way too okay with it. So the doctor asked how they were handling it so well, and the person genuinely told them that it won't be too bad because at least fingers grow back. It began a whole slew of comments from other doctors with patients who had the same misconceptions about limb amputations. Oh ha ha ha. Yes. Of course I know that human limbs don't regenerate because I am a real human. I was just making a joke. Mom brought newborn to the OB because he keeps making grunting sounds like he can't breathe. No sounds like this during the exam. They ask mom to try having baby latch nurse. She doesn't, baby is fine. Sometime later pages the nurse because he's making noises. They were bowel sounds. Normal bowel sounds. Hilarious, but she was worried. 10/10 good mom. Patient comes to the OR with an infected foot wound and streaking up the leg. Turns out they were walking barefoot on their porch and stepped on some metal scraps. Don't remember what they were from. Patient tried to remove these, but evidently a piece of one broke off in the process and was too deep to see or grasp properly. So they left it in there for over a week. Reasoning was, I thought it would fester out. Patient with seafood allergy presents to her with swollen lips, hives, itchy throat. Provider takes a history asking if the patient could have been exposed to seafood or cross-contamination. Have they eaten new food or at a new establishment? The whole nine. While being treated, patient adamantly denies this. They keep trying to figure out what the allergen could have been because it's a pretty strong reaction. Eventually the patient gets frustrated and admits they ate shrimp pasta, but it can't be from that because he took 2 tablespoons of honey first and it coats things in there. As in, shrimp can somehow not penetrate the magical honey fortress. I'm gonna need to bathe in this honey to ward off COVID. How are you feeling today? Not great. I have a cough that starts from an emotion in my throat and chest. That emotion disturbs me. A bacterial pneumonia. Roommate is a neighborhood spiritual guru. He had a bacterial pneumotion. Nurse here. We work with patients with kidney issues. Our biggest misconception. The product no salt is totally safe to eat. Wrong. No salt is a potassium-based product to mimic salt texture for food, but now puts you into a whole new issue with having high potassium from frequent use, leading to cramping, arrhythmias, and even death. Not a medical professional but a biology teacher. Anyone who has seen a picture of the pituitary gland may understand why I had a student who thought the testicles were in the brain. There are a few times a year where a teacher may have to try and hide their incredulous astonishment at student misconceptions, and I'm ashamed to say I didn't manage it that time. Did you have anything this morning for your fasting blood draw? No, just tea with honey and a glass of orange juice. So basically no, just yes. I ate a brick of Velveeta cheese this morning and I'm having abdominal pain. If I massage my prostate using my wife's dildo, it makes it easier for me to pee. Hollop on the second one. My mother, a doctor, volunteered to give a health lecture to high school girls in the South, Arkansas to be precise. During the QA period, when she asked if anyone had questions, a girl asked her if it was true that lemon juice was a good contraceptive option. She didn't understand, so the girl explained that after her boyfriend came inside of her, she would squeeze lemon juice into her vagina to prevent pregnancy from occurring. I wasn't there but can only imagine the look on my mother's face based on the way she reacted to my idiocy throughout my childhood. That was an old school birth control technique. Before we had any pills or modern methods, a sponge soaked in something more acidic like vinegar or wine, tucked up against the cervix so sperm would be killed by the acidic environment. Not just lemon juice directly up the hoo-ha, though that would just cause problems. Wanting a wheelchair to be made wider, but not wanting it to actually be wider. Client comes to my wheelchair clinic saying the chair got too small. They gained weight but want to blame the wheelchair. And could I get them a wider one? I can actually adjust the current one, but just before I get the toolbox I ask about any narrow doors. Turns out the current setup only just fits through her front door. If I make it even 1 inch wider she won't be able to get in her house. Took a while to get her to understand that widening the chair does indeed widen the chair. And no, I can't widen the seat without widening the overall width. I've had many others from wheelchair clinic. I accidentally told the parents of a 6-year-old non-verbal, not independently mobile child with global developmental delay that she would never be normal. They thought developmental delay meant she'd catch up eventually, like the difference between a train being delayed or cancelled. I had to clarify and explain their daughter would never live independently because apparently everyone assumed they knew and never explicitly told them. Clients who haven't walked in years but still don't want a wheelchair that will give them independent mobility because that's giving up. They're still determined to walk and in the meantime will rely on being pushed everywhere. I just feel sorry for them. Their lives could be so much better if they accept what they have and let me help. We now keep a mini plastic skeleton in the clinic room so I can explain what bones look like when sitting. It's used regularly with people who just can't understand what the bony parts they can feel under their bum are. I had an amputee kid wondering when his leg would grow back, but he's a kid and can be forgiven for that. Fortunately no adults with the same question yet. I used to use a cane. Foot surgery. Long story. I went on vacation with a bunch of people and there was a guy there with severe back pain. It really restricted what he could do. He told me that using a cane was the sign of a weak spirit. I told him that I was using a cane because I didn't want to screw up my back. He didn't make the connection. I had to explain to a pregnant woman once that the baby is coming out of her vagina. She was almost 6 months pregnant and was horrified. I think she thought all babies were just C-sectioned out. I overheard a guy talking to another at a pregnancy clinic. I just don't get it. She was standing up. The sperm would have just come out. How is she pregnant? And both of them seemed very confused. One person didn't think the stroke they were having was a big deal because they could get some brain transplanted from donors. Right, I couldn't even. There's so many. A load of people on medication and they have no idea what they're taking it for. Oh, do you have any health conditions? No. 10 minutes later I ask, no conditions? No diabetes? Or high blood pressure? Oh yes, I have those. Just, oh lord. Welcome to a tridge with that last one. My pre-med college roommate thought penises retracted inside the abdomen. My favorite teenage patient was asking about birth control and thought you could just wear the Nuvaring on your wrist instead of having to insert it in your vagina. Thankfully we got her on something else. When I was a young boy, I thought clitoris, didn't know yet it has a name, is basically penis, and if you pull it, it becomes a normal penis. I guess it wouldn't work. There was this really sheltered guy I knew who used to ask, which would you rather have, balls that were the size of baseballs or softballs, and we thought it was some weird hypothetical. Turned out no, he had one the size of each. Obviously, dude had some serious medical issues going on, but when we found out, I can only imagine the conversation that guy ended up having with the doctor. I'm a dentist and the thing we get all the time that I hate is parents not caring about their child's decay because they're just baby teeth. Losing baby teeth early causes all sorts of problems aside from the pain and trauma, but in addition to that I often have to explain to parents that the adult teeth that erupt at age 6 are meant to last forever. They're always oblivious. Not the dumbest, but most recent. I had a patient who needed a tooth extracted. Young teenage girl. Obviously very sheltered. She was telling me how bad it hurts and I asked her what she takes for pain. I apply a little clove oil to it when it keeps me up at night. I asked if that works and she goes not really. When I told patient and mom to control post-operative pain with ibuprofen and acetaminophen, they looked at me like I had grown a second head. Usually older generation believes that medicine takes a toll on our internal organs. It makes you more sick, they say. That's why when I have extreme headache, I tend to drink medicine in secret because I'll be reprimanded. I remember when I was younger, I had dengue, but it was more than a week before they got me to a hospital because we went to a faith healer quack doctor first. I offered a diabetic a tissue after doing a finger prick to mop the 2 drops of blood on his finger. He looked at me like I was an absolute idiot, said you don't know very much do you, and sucked the blood off his finger, then spent the next 5 minutes educating me that because he was a diabetic, he needed all the blood he had, therefore he needed to put it back into his body rather than wasting it by putting it on a tissue. He was under the impression that if he just drank his blood it would go straight back into circulation. Oof, the blatantly wrong lectures are the worst. My mother asked me once, Completely serious, why brain transplants were not possible. She didn't understand why if you had an inoperable brain tumor they couldn't just pop a new one in there like it was a heart or liver. I tried to explain to her that it wouldn't be the same person, but she just stared at me blankly. I love my mother, but oof, that was probably one of the stupidest conversations I've ever had. Previous medic here, but I don't have any sugar in my house. I'm type 1 and trying to lose weight on the keto diet. I'm drinking only water and not eating for 30 days to detox my liver and kidneys, said the perfectly healthy 25-year-old, also a medic. Oh, my daughter has croup, so I just sliced up some onions and put them in her socks for her to wear to bed. Oh yeah, that'll do it. Angry son of a COPD patient. Set my mom's oxygen higher. If you set IT higher she won't have COPD. I had to explain to a patient's dad that his son's heart was at risk due to fluid inside the pericardial sac. We call it a pericardial tamponade. That man flat out refused to believe that human hearts have a membrane around them because he had dissected a sheep heart in high school and never saw no sac. Former EMT, if I have to tell one more person that nothing will detox you but your liver and kidneys, not some dang concoction you drink. Well, I had one girl that really thought if she had sex in the shower she could not get pregnant because all the sperm must fall out and go down the drain. Her boyfriend had been convinced as well. They did, indeed, end up pregnant. There had been a lot of stand-up shower sex. I caught a patient drinking his own urine once. He thought it would help heal him. Somehow, I have never looked at a water pitcher the same way, and I always check to make sure it's water. The one is about a nurse. I had to help another nurse put a Foley catheter in, a sterile tube that drains urine from the bladder. She, new nurse, had been trying to put the catheter into the patient's clit. Needless to say, the nurse was confused and the patient was confused as well. When I put the catheter into her urethra, obviously not her clit, it felt much worse for the patient than what had previously been going on. That last one. I'm a woman, and up until high school, I honestly thought that women peed out of their clitoris because, in my mind, the clitoris was just a smaller version of a penis. I once administered a certain type of breathing test to a 58-year-old female patient who worked at a manufacturing plant on 8-hour shifts. In self-reporting her smoking history, she told me she smoked up to 8 packs of cigarettes a day. I think her misconception was that she was going to live forever. How the frick do you even do that? I'm a veterinarian and I can't tell you how many nipples I have diagnosed. P.S. Sorry, that's not humane body, but thought it was fun to share. My favorite vet story along this line is from a friend who owned rats. She took her rat in one time for abdominal tumors. It was his balls. Male rats, as I'm sure you've seen, have massive balls. My favorite was a patient calling my department 3 times with concerns about having to abstain from taking her blood pressure medication prior to an exercise treadmill stress test. She's afraid one missed dose of her metoprolol will give her a heart attack. She is very concerned because her blood pressure is so high these days. So I asked her if she's taking all her prescribed doses. She said she's supposed to take it twice a day, but often she only takes it in the morning, and only half of what her doctor ordered. So effectively this lady was taking 1/4 of her BP med and couldn't figure out why her pressure isn't under control. I've had a few good ones, but the funniest actually happened during my first year of college studying PT. Someone raised their hand in A&P early on in learning about muscles, their attachments, actions, and innervations. She asked why humans don't have meat like cows, pigs, and other edible animals. Prof stalled for a second holding it together, then asked if anyone else was wondering about this. Roughly a third of the class, perhaps 20 people, raised their hands. She spent the next few minutes explaining, convincing people that muscles are in fact the meat. It was hilarious. I honestly think that most people subconsciously prefer not to bridge that mental gap. It's simpler to see meat as an industrial product than as an organ coming from a living thing. Not me, but my sister, currently in residency. She was with a patient who had a severe pain in her thigh. They screened her, ran thousands of tests, and nothing came out of it. They later found out she had a bullet in her arm, but that it had hit her from behind, so it couldn't be seen when she lay down on her back. She thought her thigh was in her arm. I seriously do not get how they didn't find it since this is more common in situations, but I guess mistakes slip through sometimes. This is why I always ask patients to point to the pain with one finger. Patients call body parts all kinds of crazy non-anatomical names. I had breast reduction surgery. My husband went to the pre-op with me. The doctor was explaining the surgery and mentioned they would remove my nipples. My husband asked where they were going to get new ones from. 12 years later and we joke about wondering where the nipple locker is. I've had male patients in my audiology clinic tell me they have fallopian tube issues. Perhaps I shouldn't assume they mean eustachian tube issues, but I do. I'm in the mental health field, but I met with a client who was worried that if their relative had a heart transplant, would the relative still love and remember them? The logic being that the feeling of love lives in the heart. Hallmark cards from heck. Not a medical professional, but I have a major medical condition that can damage the lungs. If one is having a flare of said disease, a great big warning sign is coughing up blood. So, every single doctor I see, no matter the speciality, asks if I've coughed up blood. I finally asked one time who in their right mind doesn't call the doctor or 911 if they are coughing up blood. The doctor looks at me and says a whole lot of people. I did work in care management for medical insurance. One day I was doing paperwork and the care coordinator next to me busted out laughing. When I asked why, she said that the man who was on the phone with had just had quadruple bypass and was on his way home from a month-long stay. He was calling to coordinate his cardiac rehab. While on the phone with her, he was ordering his 20-piece from KFC. She said, "You have to laugh or you will just hate the world." I'm training to be a midwife, and once met an expectant father who panicked when he heard that his daughter was breech because he thought this meant that she was going to come out of his wife's ass. Actually took a chunk out of the inside of my cheek trying not to laugh. I explained to several women over my medical career that they do not pee out of their vaginal canal. A few did not believe me. I knew a guy who legitimately thought that he could tell how loose a woman was, never mind that statement even, by how loudly she peed, because women pee from the vagina. He was married and in his 30s with kids. Not a medical professional, but I was at the hospital after an injury and another patient who just had his left leg amputated asked the doctor how long it would take for it to grow back. I thought he was joking and chuckled. He shot an angry look at me and I realized he was serious. OMG, I am so sorry for the doctor who had to tell him. Can't imagine that. I was getting dressed for a hunt with my EMT friend and he goes, "Dude, you've got a hernia." I was like, "No, I'm just growing an outie." He then proceeded to tell me how dumb I am. A few months later I had hernia surgery, SMH. This isn't so much a misconception about the human body, but when I was in a nurse, a common misconception from patients was that I was testing their urine for drugs, and that I would call the police or report to their employer that they popped positive for something. If this has ever been you, know that it is illegal for us to disclose a drug test performed for medical purposes to anyone without your permission, including the police, aside from litigious situations when it's required. If the police brought someone in handcuffs and wanted a drug and alcohol test, it was a whole lot of paperwork, and if I remember correctly, they needed a court order. Also, I do not give a crap if you do drugs. Just tell me the truth so I can help you, and so I don't accidentally give you something that could interact with what you've taken and make things worse. The conversation stays between us and the doctor, and I can assure you we don't give a frick and we would be fired for disclosing that information to anyone without your permission. Here is the fastest way to suss that out. I'm not your mom, a judge, a cop, or a priest. I don't care. The only reason I need to know is so that I don't accidentally kill you by giving you something that doesn't jive with whatever you took. I had to explain to a couple 45 plus that treating the wife's yeast infection only but continuing to have sex without treating the husband would result in them both having a yeast infection. A young, talking maybe 17 years old, that feeding their neonate powdered milk was not the same as formula and that they were starving the baby. So many. So many. I had a family feeding their newborn only chamomile tea because the baby had a cold and they thought the tea would heal them. Baby ended up in the hospital from severe malnutrition. Had a mother ask if it was true that the soft spot of her baby's head was like a whale blowhole that he could breathe out of. Apparently her own mother had told her that. Shoulder rehab after surgery on recurrent instability. Range of motion was not improving, so I ask if the patient is in pain. Oh no, but I can't move my arm past 90 degrees because I feel the screws the surgeon put in and I don't want to break them by forcing the movement. It was the acromion bone. After a visual explanation, flexion magically went up to 120 degrees. Maybe the surgeon could have explained the procedure better, but sometimes I spend entire sessions repeating the same thing only to have patients ask me the same question over and over again. Health-related beliefs and fears hold tight in our brains. Working in as a nurse practitioner, I had a patient's granddaughter, who was pregnant, ask me if she dyed her hair would it also dye her baby's hair. Made my day. There are people who legit believe that using hair dye, during your period or otherwise, versions vary, will alter the color of your blood, among other things. It's a bit painful how common this type of thinking is. Can you email me my medications? Sure, I can send them electronically to any pharmacy you want. Number. Skip the pharmacy. Ain't there some fancy schmancy way now you can send an email of some kind, and I just print it out and eat it, or I scan it with my phone and listen to it with headphones or some or other? I'm afraid not, sir. You know, one day we will look back on this comment and laugh as we print out our daily vitamins. Obligatory. Not a medical student, but for years my periods or right before them were downright awful for me. Not necessarily in the pain sense, though that hurt too, but because the week beforehand I'd completely changed from my normal mood to extreme suicidal depression and would self-harm due to the absolute distress my body felt. Like, it was almost like I could physically feel myself turn grey. I would bang my head against walls, hit things, etc. if only to break the feeling of this extreme distress. Like, the only thing I can liken it to is that one scene in the Green Inferno where the guy is tied up, drenched in honey, and thousands of ants eat him alive. I would feel it under my skin to the point where I wanted to rip my skin off and turn it inside out to get the ants out. Anyway, after I turned 18 I brought it up with a doctor who immediately paused, looked at me wide-eyed as I rationalized it was probably nothing because everyone has period troubles, and he was like, no, that's not anywhere near how that's supposed to happen. I was diagnosed with PMDD, premenstrual dysphoric disorder. I used to take retinal photos to look for diabetic retinopathy. When I would call to make appointments, more than once a patient said, well, I just saw the proctologist. No sir, these are retinal photos, not rectal photos. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.